I wanted to let you know before I started today, now this may tax my credibility with you, but God sent me a device this morning. You believe, the divinity people here believe me, they've seen miracles. This came from God this morning, and it said, I'm going to send you a device which will show you who's really responsible for the problem in healthcare today. All right? Shall we open it? I don't know what it's in here. This is. Oop, there goes the rubber band. Uh-oh. Uh-oh. You know, whenever I ask God who's at fault, he sends me this thing, and, oh, there's the guy who's at fault. You see, we're at fault, right? Because we run the health system, don't we? Who runs the health system in your community? You do, right? Who takes care of patients? You do. Who oversees people? I mean, I do, right? Who's responsible for what's going on in healthcare today? Looks like we are, right? I'm going to share with you some information about what's happening in healthcare today. And this is from a survey that was done with about 3,000 patients. It was done in January this year, so we can't even claim it's old. You know, I was looking for a way to get out of this, but, you know, it's like the mirror thing. You just sort of look at the person in the mirror and, you know, it's a problem. We at Physicians Quality Care, there's a number of evangelical Christians. I happen to be a born-again believer. I could give you my testimony if I had time today. I was saved when I was 13 years old, and every day the Lord works on me a little more. But we have a number of evangelical Christians who are on the board, who founded the company. And we have a passion for the poor. We have a passion for business and for physician ownership and physician leadership. But we have a tremendous passion for the poor. And you know what we found out was, so do a lot of other people. And we found out that the best place to give care in the healthcare system? It's at the church. Did you guys know that? Because, you know, about 40% of the healthcare cost problems with the poor are about problems with their behaviors. Smoking, drinking, things of that nature. So what we need to do is to get the church involved, right? That's what we really need to do. Not draw away from society, but jump in, all right? And there's lots of people in these health organizations. I could tell you stories about people at for-profit hospitals. A good friend of mine, who I couldn't believe he's a good friend of mine, is the head of Columbia here. A guy named Don Maloney, a great man. He's a good man. He has a heart for the poor. United Healthcare, you know, people, oh, God, United Healthcare. These guys have a heart for the poor. They have a real interest in the poor. And you'd say, how can that be? They're, you know, greedy insurance companies. They're, you know, they're for-profit hospitals. People run these organizations. And you can have a lot of impact, and I'll talk to you a little bit how you can have an impact. But I want to first of all tell you what the public thinks of you, right, and thinks of me. What's the major problem in healthcare today? What does the public in general think of healthcare? What are the alternatives for meeting the needs of the poor within the frame of the current system? And what will happen if managed care is not successful at controlling costs while improving quality? And then we'll talk a little bit about PQC and how at least we've tried to address it. It doesn't make it right, it just makes one of the approaches. How many of you here are willing to work for just the cost of living day to day? Nobody? I'll give you 20 grand a year, you'll eat fine, it'll be okay. The problem is, people get paid what the market bears, right? I asked the doctor, I said, how about if I just covered all your living expenses? Well, like a parsonage, you can live like the preacher, right? You know, their eyes get big, you know. What? That's crazy. Right. But that leads to rising healthcare costs, right? How many of you physicians and nurses expect a raise this year? Come on, you can be honest. It's okay. It's okay. You can say you expect a raise, right? Well, where's the money come from? Well, it comes from somebody who pays for the service. The taxpayer, right? The employer. How many of you are employers who actually employ people? Come on, raise your hand. That's okay. You awake? I know it's almost lunch. Okay. Now, do you give your employees health insurance? Did you pay more last year than this year? Or this year more than last year? You paid more this year, right, than last year. It keeps going up. How come? Because of you. How'd that happen? Wait a minute. You know, it's like the mirror thing, right? You know, as an employer at PQC, we actually have health insurance. And I was sitting there one day thinking, man, this health insurance keeps going up, but I wonder why. Because of me. Because of the way we practice, right? You go, whoa, it's me in there. Look at that. It's me in there. Right? We don't expect our ministers to live for free, right? How many of you go to a church where the minister gets no pay? Nobody, right? They were born not just yesterday, right? I mean, they were, you don't expect them to do that. So then the question is, it's about resource allocation. There's resource allocation decisions going on every day in your community, right? And there's going to be some really bad decisions made. Do you know where medical euthanasia is going to come in? It's going to be because Christians don't get involved in organizations and blow the whistle when something's happening, right? I'd like to see about 10 Christians on the board of Columbia HCA. And when Richard Scott's maybe, as any man does, makes a bad decision, somebody says, that's not of God, and you shouldn't be doing that, Richard. That's blasphemous, and we should not have that happening. I'd like to see 4 or 5 Christians on the board of United Healthcare. Somebody there saying, hey, let me give you my counsel. I don't think that's a good idea. Maybe there's another way we could do this. Instead, we withdraw and say, that's bad. Ooh, I'm not doing that. Hey, that's not what you want to be doing. You want to be getting in those organizations. You want to co-op people. You want to go in there and say, let me tell you about Jesus. I sent the vice president of managed care for Columbia here a Bible for his promotion. You should have seen the look on this guy's face. What's this? It's a Bible. It's got some great ideas in it. You'll like it. Life Application Bible. Open it up. It's great. He brought it to work. He left it in a drawer. He's almost got the guts to bring it out and put it on his desk. It will change Columbia forever. He's going to put it on his desk. I'm telling you, we can change the world. Hey, we got the best product in the world. We got Jesus, We got a great product. We got the answer to problems. We got great answers to problems. We don't have bad answers. We got great answers. So don't, get in there. I'm going to, save every executive at United Healthcare, save everybody at the Blues. You're going to make them all part of God's kingdom. But you're not going to do it if you're sitting out there with a big brick throwing the bricks at the wall. Yeah, managed care, they're all satanic worshipers, Forget it. Forget it. It's not going to work. It's not going to work. I'm telling you. All right, let's talk about what patients think about the healthcare system. 87% of patients, now this is done with 3,000 patients of all demographics, all ages, poor, rich, everything, okay? 87% of patients believe the quality of medical care must be improved. That's probably not real surprising. 79% believe there is something seriously wrong with our health system. That's not good. 80% believe hospitals have cut corners to save money. I always tell my friends at Columbia, I said, what happens is, you guys go out to Wall Street and tell them how much money you're making, right? And then people figure if you're making money, you're taking it out of care. I said, what you got to do is you got to parse these things out, like only give people access codes to read the earnings numbers and then tell everybody else, we're up for care. The problem is people think that doesn't, that doesn't allow for both to exist. The problem is profit-driven systems aren't inherently bad. And let me tell you, too, people say, well, aren't profit systems good? I said, I looked at the Baptist Hospital in Nashville. Nice people. I couldn't tell the difference. Which one's for profit and which one's not for profit. They both run the same way. We're a Baptist hospital. Oh, really? I said, oh, gee, it kind of looked like it was all the same to us. You used to have a bigger marketing budget than the Columbia guys do. So, the idea of Sister Agnes, going down the hallway ministering to, that's over. These are big businesses, right? The Catholics are big business. Right? You got to understand, guys, all these people are big business. So one's as good as another. Except you want to get, like I love to talk to the nuns to say, hey, let's talk about what we do with the poor and the mission and how do we, get the gospel of Jesus, maybe get the ministers in there. See, because the kingdom of God's at work all the time, guys. You don't think that the kingdom of God doesn't have a lot of control over Columbia or over United Healthcare? Hey, they do. But you know what? You're not in there talking to these people. We have a whole big church. You got to just, I'm telling you, it's lunchtime. Anybody here have coronary problems? I will ask her to leave now because I don't want to tell you that she'll drop dead. We're actually working on a project with Columbia and United Healthcare to put church-based clinics around the south side of Chicago. Right? Hey, these people are good people. You go and say, hey, you know what? We need to take care of the clinics and take care of the poor, and we're going to take care of everybody who comes to the door, and we're going to show them the love of Jesus, and we're going to preach the gospel to these people, and we're going to take care of them. And Columbia says, yeah, and we're going to give away free care at our facilities. Oh, you are? Wow, that's great. And United Healthcare says, yeah, and we're going to help you build the thing out, and we're going to help you maybe bring a doctor in there. Did you ever know that? Do you think a greedy insurance company would do that? Isn't that shocking? You know, I'm sitting there thinking, whoa, I'm convicted. Whoa, you know, I'm back to the mirror problem. You know, I'm like, oh, look at who's the problem? It's the guy in the mirror. The other thing is 74% believe quality care is often compromised by insurance companies to save money. You know, don't you all have to say we're partly at fault, you know, as providers? Well, your insurance company won't let me do it because they're greedy. I mean, we tell people that, and then they believe it, and then they tell other people that. The problem is the insurance company is the only product the patient can afford, because we're going to get to affordability in a minute. That's another big worry for people. 75% believe there are serious problems with the quality of health care. Patients basically think health care is mismanaged. Now, you've got to remember, we live in a society where a computer today can do about 1 million times more than it could 25 years ago and costs a fraction of the price. Now, how many of you bought a Japanese television in the last year? Come on, raise your hand. Are you an American? Why did you buy a Japanese television? Tell these people. What is the matter with you? Tell these people. It was cheaper. It was cheaper. He put Americans out of work. Isn't that awful? Well, we're consumerists, right? Aren't we consumerists? Isn't that what's going on? And what people think is healthcare is a bad deal. And by the way, I don't necessarily only think that building these great big monuments is going to make it better. I would disagree with, respectfully disagree with the former speaker that making, big integrated things with tubes and pipes and all that, I'm not sure that's going to make it better either. But I think we've got to figure out better ways to do it. We have to. We cannot. And we've got the best product. I'm telling you, church-based health care could be the best thing that happens to the country. And not church-based health care for Christians. That's putting up walls. Well, we go to this church's health system. Oh, well, that's great. How about everybody else? Because we want to bring them in. That's what our mission is, right? Social responsibility, evangelize the world. And, we're not acting that way. I mean, let me convict you all. How many have love in the heart for the insurance company? Come on. How many of you have love in your heart for the insurance company? All right, I got one honest believer. There we go. The rest of you, thank you for being honest. Okay, you need to get a little love in your heart for the insurance company. 72% believe the federal government can play an important role in making health care more affordable. That's great news. Whoa, good. People think the government can do it. I think that's real bad news. 74% believe the high cost of medical care is due in part to the greed of the insurance companies. Well, everybody here saying, the public knows. Hey, well, the secret's out. Well, the bottom line is they think docs are greedy. I'll get to that later. They think everybody's greedy, and they think it's mismanaged. So people don't think they're getting a good deal right now in health care. And here's the other weird thing. 40% said they can't afford medical insurance. Hey, that's not good news. 82% believe medical care has become a big business that puts profits ahead of people. The former speaker, the speaker just here said, we're going to be big and corporatized and all that. What happens is that the populism in the American consumer runs deep. We are a populist society. We distrust big institutions. We really do. There's something about us that distrusts them. What happens is, because we know that big institutions have a great ability to do great harm. We've all seen that, haven't we? Haven't we seen that? Well, what happens is, big institutions are good because the people get in them and make them good, right? Like churches. Churches have a great ability to be bad, but because the people in them, they're good. The same thing is true in big companies. Big companies have the ability to do good things and bad things. It depends on the people in them. 24% believe the health insurance companies put the needs of customers ahead of profits. See, that's not a good number. 53% believe there's not much care left in healthcare, and only 32% believe health insurance companies really care about their customers, and 44% do not have much confidence that the healthcare system will take care of me. That's not good. You know, if you were Walmart, you'd be out of business, right? Over half the patients worried about losing coverage or coverage is changing with less coverage. So here, these people, what do they want it all? They want cheaper and better? What are they, commies? I mean, come on. Cheaper and better? That's un-American, right? Whoop. Cheaper and better, that's un-American, right? How dare those people demand cheaper and better? What do those people want? They want everything from me. What's the problem with these people? They want everything. Well, you know, I guess that's right. You know, our one honest person here talked about his Japanese television that he bought. He bought it because it was cheaper. He thought it was better. How many of you buy rotten fruit? No. Wouldn't you buy some American rotten fruit and, you know, let the Japanese good fruit go? No, you're going to buy the product. And that's what these people are telling you. They don't like your product. It doesn't work very well for them. And you know why people like managed care companies more than you think? Because the managed care companies are trying to fix it. And we don't like the way they're fixing it. So they try to fix it, and we say, don't fix it. And these go, but the consumer is telling me to fix it. And we're saying, don't fix it. And instead of saying, well, how would we fix it? You know, how could I get on an advisory board to your company so that perhaps I would have impact on your decision? Oh, you know, you don't have to like go in and think, you know, you're going to be a part of the occult for going in their building. It's not that way, right? Go on in. Call the CEO of the health plan and say, hey, I got some ideas that might be useful. Go to the CEO of the hospital and say, how can I be constructive? How many of you are guilty of throwing stones at these people constantly? Get over it. I mean, come on. We have got to figure out a way to make it better, different. You know, would Jesus sit there? You know, it's like the Samaritan woman. We're going to stone her. That's what we're going to do. He's not going to do this. He's going to say, hey, let me tell you, I can make it better. I can make your life better. How many of you have witnessed to somebody from an insurance company? Thank you. What was the reaction? Did they come to church with you? Yeah. It was good. They didn't turn their head around and throw up. You know, it was great. You know, the last time we killed Clinton Care, right? I remember one of my nurses who works for me, she had a big bumper sticker that said, Clinton Health Care. All the compassion of the IRS with the efficiency of the post office. You know, great, great. But you know, here's what's happening, right? You got 72% of people think the federal government can play an important role in making health care more affordable, right? Well, why is that? Well, it's because they don't think it works today. You're fighting the consumer. You know what happens when people fight with the consumer? The government comes in with this big ball bat, and they go, stop it, right? Isn't that what they do? Because you know what? Who votes them into office? The consumers, right? My constituency. Well, you know, hey, right? I have to listen to the voters. You know, well, that's okay. But when you listen to the voters also happen to be, you know, the guys who elected me from the fair state of Texas. You know, those people are the ones who elect this guy. They're the ones calling him saying, my health care insurance is so bad, I can't afford it, and it doesn't work, and they told me I can't have my lab test. You know, I've got to drive 47 miles for a lab test. And the guy goes, there ought to be a law. And, you know, he makes one. And then we got to live with it. You know, no driving 47 miles for a lab test. Does that mean we can drive 46? I mean, you know, it doesn't work at that big macro level. They do goofy stuff. But it means that you have failed. You know, we're back to this, you know. Why does Congress pass laws on health care? Why isn't Congress passing laws on computer systems? Because patients are satisfied, right? Isn't that why they don't? Can you imagine somebody saying, well, I'm going to pass a law that says I can't spend more than $1,000 for a computer? The people from the computer institute say, forget it, I'm selling it for $950. Right? They've already figured out a way to drop it down. You're back to this. This is why politicians get involved in anything. It's the failure of the people in the system to deal with the issue. Here's 84% believe the government should intervene when providers do not meet standards. I haven't figured out what that means. Like, is that a public flogging? I mean, what is it? I mean, is it a, you should have not given that shot. You know, you have the sort of the goon squad that runs around and pounds up people. Doctor, you're here for your public flogging. You shouldn't have written the ACE inhibitor for that patient. 86% of patients believe the government should set standards for quality of care. That'll be good. That's very good. Woo, boy. You know, that's not going to be pretty at all. But you know what? We're going to deserve it. I tell people the last shot we have at this thing is maybe, you know, now I know this. Are y'all holding on? Is it lunch yet? I mean, nobody die here, please. We have ministers that can help, but don't do this. The last chance that we may have before government health insurance may be managed care. I mean, I hate to say that. It might be the health plans. Because right now the government, they think reformed managed care is the right policy. If it fails, guess what's coming next? National health insurance. And then whatever the political will is. See, I think it's harder to manipulate the market than it is to manipulate the political and media system. I personally believe that. I think there's a lot of people who get up, do a lot of demagoguery, and then we're suddenly killing people instead of, you know, at the end of their life, instead of caring for them. Because there's, you know, anybody can do anything with a poll, you know. And I think there's a lot of politicians are very crafty people. Not in a bad way. There's a lot of good politicians. But I'm much more reasoned that if it's held at a macro level or a micro level, I don't know about what's happening in Oklahoma, but I can help what happens in Chicago. And I don't like the idea that Washington could set policy and standards which we will not like. You know, the last time they did it was called Roe v. Wade, right? You know? That's an example of what really goes bad when the government gets really involved. All right. I'll move here very quickly. Reform managed care is viewed as a solution by most policymakers. The health system is not perceived favorably by the general public. How many of you would understand that? You know that. I'm in it, right? You back to the mirror. I can get the mirror out, but I think you got the point. Welfare reform will bring higher number of working poor to healthcare centers. That's going to be one of the weird things about welfare reform, is we may actually see more people hitting our centers. Policymakers have focused on reform managed care, but I'd say this again, national health insurance waits in the wings if we blow it. How many of you spend a lot of time in Washington or talk to policymakers a lot? I bet, you know, Dave Stevens probably does, some other people. I mean, this thing's still popular in Washington, that national health insurance. You know, it's like, what planet? You guys like, you know, you expect to see the range, that little rover thing like in Mars and Washington, because these people are on another planet. But in Washington and a lot of these places, national health insurance is alive and well. There are some people, there are some politicians who think it's the only solution. And they're waiting for us to fail at managed care, then they're going to go to national health insurance. And then people will beg for it. We actually have a little update. We're actually managing about 150,000 patients today. And we're involved both in managing multi-specialty gatekeeper products and as well as we call open access or single specialty networks. I think that the right model is lots of different health plans, lots of different, you know, models, lots of different benefit plans. Let people pick, give people choice. My brother works for I don't know how many from Chicago, Dominic's food chain. He told me one time that he was convinced in 1985, you know, this is one of those great predictions. He said that he was convinced, this is during the big coffee crisis. Remember that, you know, we couldn't buy coffee and people were committing crime because they couldn't get their coffee in the morning and, you know, civilization started to crumble. He told me that there would be one brand of coffee and it would cost 30 cents a pound. I said, well, I said at the time, Mark, you know, people kind of choice-driven. You know, I mean, people just don't like buy all white or black cars. You know, I mean, people like different colors and, you know, like 31 flavors. You know, people like more than one flavor of ice cream. You know, well, today, I mean, you can get coffee. I mean, what, you go to Starbucks and you can get about 400 kinds of coffee. Well, that's about what our society. I mean, I think people want to be able to craft their own care. How many of you think MSAs are good ideas? I think they're pretty good ideas. I mean, I think there's a lot of benefit. Why? Because it gives patients choice. It gives people the ability to craft their own health care. That's the good of consumerism. It lets people pick. I mean, in Russia, the whole thing fell apart from its own weight because people didn't want just to buy one, car. They didn't have a lot of choice. Our economy says that Adam Smith's invisible hand works pretty well. But it isn't going to work really well if we're going to continue to resist it and fight it and yell about it. And the other thing is, people screaming from the outside of these institutions isn't nearly as effective as going up into the institution and saying, hey, let me tell you about church-based clinics. And let me tell you about how we ought to, take care of the poor. I mean, who's against that? I mean, is there the center against treating the poor? I mean, there's nothing like that in Washington. Right? Everybody's for doing that. And what you can do is, if you give people a constructive venue, you can find people that will want to do that. Let me talk about our company a little bit. I won't do too much of that. I talk about it too much. We decided that there were some things we weren't going to do. Like, we don't touch abortion. If the health plans have to offer it, and there's a good example. We don't have to provide the service or treat it. We can keep it at arm's length. You got to provide that. You do it direct. The health plans hadn't historically done that. We explained our feelings and our position on this. And you know what? They were very willing to work with us. They said, fine. We have to, by state law, mandate that. So they have a direct number. So I never know what goes on. Our doctors don't have to refer it. We don't have to touch it. See, that was one of those things, had we not engaged them, it would have been a big fight. But we engaged them. We explained our faith and how it was a problem for us. And they said, we respect that. Shocking. I know. It was shocking. We also said that poor patients should be able to see all specialists, regardless of their ability to pay. We just all agreed, everybody in the boat, that's it. We also co-opted some hospitals, a Catholic hospital, a Columbia hospital. We said, hey, let's get these guys involved, right? We got the churches, we got 12 churches involved. We got all of these things happening. We have 5 centers today, Christian-based organizations in the south side of Chicago, and we're hopefully going to have 5 or 10 more, whose sole mission, we bring medical missionaries in. They're all federally qualified health centers. We bring medical missionaries in, and I actually serve on the executive committee now of an organization called the Jericho Road Foundation that plants inner-city church clinics or church clinics in poor areas around the country. Well, we have corporations who fund Jericho Road, so we can go out and train churches to put up clinics. That's kind of fun. We're using health plan money to spread the gospel of Jesus Christ. Oh my gosh, it's amazing. God's a big God, right? It's pretty amazing. He can part the Red Sea. He can get the insurance companies to fund our activities. He can do anything, right? We make God too small. I'm going to plant myself right here in the path of this train, and I'm going to knock it down. Wait a minute, maybe there's a plan B, like, step out of the way and jump on the train and, take over the conductor, and, you can do the whole thing. Right? I mean, we ought to have the president of Columbia HCA be a Christian, right? What would that be if you had a Christian at the head of some of these organizations? What a force for good that could be. But you know what? We can't do that if we're whipping rocks from the outside. They're never going to open the door. We want to do all those things. We want to engage people. We don't want to do the other thing. We don't want to get mad. If I can say one thing, would you promise me you won't be mad anymore? Don't have that anger. Don't be defeatist, right? Jump on them. Go find somebody from a managed care and say, let me tell you about Jesus, and we're going to go put up a church clinic, and it's going to be great. And people are going to get better, and it's going to be okay, and their lives are going to be turned around. All that stuff. Because that's what's fun. And they're like going, yeah, that guy, he's crazy, but we'll go with him, We're up for it. Let's go. Let's try. Because they know our heart's in it, right? We have a heart for the poor. And that's what you have, a heart for the poor. Don't hesitate to tell people. You go to somebody and say, I want to treat the poor in my community. I want to treat the uninsured in my community. I'll work with you. I'll have high integrity with you. You can trust my word. I will be your partner. I will work with you. That's what you need to do. Not get the flamethrower out and they're all, meet you with asbestos underwear in the front of, oh my gosh, my Christians are here. You don't want that to be the way it is. You want it to be, yeah, these people understand. Because you understand that God makes everything happen, right? So God put the insurance companies there. Scary thought, Yes, he's infallible. Oh, yeah, okay, that's right. That's right, he put the insurance companies there. There are people there to minister to. Now, when we walked into this situation, here's the good and this is how you can do good. The poor patients in our service area were either Medicaid recipients or working uninsured. They were unable to see local specialists, right? Medicaid care was mostly provided through local ER and with little, if any, and tertiary health services, especially OB, did not exist. Did not. Let me tell you how OB care was done. I want to use the word clinic loosely. It could have been a drive-through hamburger stand. They had a medical sign on the door, but it wasn't really clear that's what was going on inside. So there were 90 pregnant women in this clinic. There was one guy who would come down. He was a Medicaid mill doctor. He would come down for 5 hours a week. And you basically had everybody lined up. I saw it. It was unbelievable. 90 people lined up. And at 5 hours, from 1 to 5, he was there. And at the end of 5 o'clock, he went out the back door. So then you got your visit next week. And that's kind of how they ran it, right? Now, that was going on. By the way, that was going on under fee-for-service medicine. Isn't that special? It didn't mean that was going on because somebody bad in a managed care entity or a hospital. That was going on because nobody shone the light of day on that thing. So the first thing we did was fire that guy, brought in now 8 local OBs to provide care. The hospital then hired 2 more OBs. And in the Chicago Heights area today, women get great OB care. We have an agreement with the University of Illinois where all of our high risks go down there. We have churches calling the women at home saying, why'd you miss your appointment? Right? You mobilize the church. You got all these people at churches just want to do good. That's all they're supposed to do. They got all this Matthew 25 stuff. They got to, God's going to judge them at the door about, did you take care of me when I was sick? You got ministers that think about that all day. It's like a payer minister. He thinks about the Bible all day, and that's what he does, okay? So we go there and he go, hey, we got some people who need some health care. And he goes, Matthew 25, I remember that from the Bible. I went to divinity school. It's in there. So he goes, great, right? He goes, great. We're going to go help people. These people are just, and you know what they're going to do? The worst thing they're going to do, they're going to share the gospel of Jesus Christ with these people. It's okay. It won't hurt them. It'll be okay. But you're going to mobilize people, right? And you're going to get the health plan to get in there, and they're going to go build this thing out, and they're going to make it a beautiful clinic. It was a dive. And United Healthcare went in there, and they fixed this thing up. It looks nicer than my home. It is beautiful. It is really nice. It's an awesome thing. And you know what? You guys, I don't know who your local health plan is, but I bet there are people who do the same thing for you. If you're if you're head of United Healthcare, do you want to go down to a Medicaid mill and say, oh yeah, me and the rats here would like to welcome you to Dr. Jones' office? Forget it. They want to go somewhere really nice where it says, this is what United Healthcare's vision of care for the poor is. Right? They don't want to go. They want to go somewhere where it's nice and where there's high integrity people and there's a lot of compassion there for the poor. That's what you want to do. Well, let me finish up a couple things here. We did partner with a local health plan. I can't say enough good things. Our docs like United Healthcare. They're good people. We developed comprehensive specialists in tertiary. We developed a 24-hour, 7-day-a-week telephone triage. We developed comprehensive community and hospital networks. We developed intensive case management approach. We developed a network management philosophy with patient quality and cost. You know what happened to our immunization rate? It went right up to 90% because somebody cared and they did something about it. We have a health fair, comes up every August. We immunize 1,000 kids in the neighborhood. We have United Healthcare, we have St. James Hospital, we have Columbia Olympia Fields. All these people get involved. We have a big party. McDonald's feeds everybody. We have 40 doctors from PQC there, and we run 900 kids through the clinic. We give them all their school physicals, everything. We give them immunizations. So it's like, don't worry about the next government grant. Just go out there and do it. Network, talk to some people. They're going to want to do it with you. What is it? It's a no-brainer for you. Typical services provide. These are the things we provide. Now, we provide managed care services because that's what the model of healthcare is, right? That's the state's mandating MediPlan. So we figured that's the way we've got to treat the poor, then we'll go out and figure out how to treat the poor. Got to be able to do home health or do managed healthcare. So we provide all these services. If you look at our Medicaid bed days, look what happened to them. Better care, top specialists, good access to OB care, good access to pediatric subspecialties. Ooh, suddenly the bed days go down. That wasn't because we put some big computer systems in. This is because people started caring and watching. Not because, we put some massive thing in place. This is because we worked hard and we did a lot of the blocking and tackling. Good managed healthcare is not sexy or glamorous, gang. It's a lot of hard work. That's all it is. So next time somebody comes in and says, I got a computer system that'll do managed care, take them out, say, no, that's not how managed care is done. It's done with a lot of hard work. Computer systems are important, but that's not the key. We think physician ownership and leadership provides the opportunity to develop approaches to the poor and the community. We believe that. We believe physician ownership and leadership provides the better opportunities to share your faith. We think physician ownership and leadership provides better control for the healthcare system to ensure equal care. And we think physician ownership and leadership is attractive to health plans interested in Medicaid managed care. If you have high integrity and you have physician leadership and you're a good partner to them, it's a great relationship. And they have an interest in seeing you do well too. Plus, you partner with your communities. Go down to that really tough section of the city. Those people are great people. In those churches, in a lot of those African-American churches, they have such a heart for the poor there. I mean, they just are excited about the idea of having a good clinic where they can provide great care. It's just a tremendous opportunity for you. This is what I would recommend. Make the commitment to treat everybody, regardless of their ability to pay. Challenge your organization to tackle the difficult patient populations, right? Go after everybody. Somebody comes in with some, horrible disease, figure out a way to take care of them. Figure it out. And then I would partner with local churches and leaders to establish church-based clinics. We think just that's the key to the whole thing. Partner with health plans. Go today after this conference. Go and find people in the health plan. Go to lunch with them. Say, I want to talk to you about the poor in this area. I want to talk to you about how a different approach to Medicaid. You think managed care companies have answers? They're looking like you are, just like Columbia's looking. They don't know the answers. They're looking, they're searching. And what they're looking for is people of goodwill and people of good faith to say, I think I got a good idea. Now, we all know the best product in the world is Jesus, right? You put Jesus in a situation, it's always better. You take the impossible, you put Jesus in there, it's better, right? And a lot of times what we've done is in our secular society, we've divorced our faith from the problem. And probably the solution is having the gospel. Because think about the cost, medical costs. We just sued the tobacco companies out of $400 bazillion, right, to make them pay. How about instead get all these people to quit smoking, right, by getting them into a faith-based church program? It would have been cheaper. We could have saved the lawyer bills. It would have been great, right? But we're having the secular reaction. We're suing each other, we're in court, we're going to sue you, right? And these other guys, we're going to kill people in the tobacco company. It's crazy. We can change it, but we're going to have to change it from the inside out. That's the problem with healthcare. The problem with the poor is because their habits are bad, they don't eat right, they got bad habits, they're on drugs, all these things happen. But we can't, you can keep treating somebody's medical problems, but if they don't get off drugs or stop smoking, it ain't going to help much. The doctors will tell you that. So you got to change behaviors. We have 5 centers today that we work with: Roseland, St. Mark's, Oak Tree, Jericho Road. We're starting now with Mount Olivet Baptist Clinic. We have additional company commitments to the poor. We believe the poor is where we can shine. We take tough patient populations, and people at health plans are very impressed. Go, wow, you really turned this around. Well, yeah, we worked really hard, and we had some really good ideas, and we really worked at it. But mostly, I hate to tell you that our success with managed care, I think, is mostly because of the churches, right? And that's the great difference. And this is a great opportunity to bring God into the whole equation. Because what we do, right? God's over here, we got God over there, we got health care over there, right? And we don't bring them together. We don't do that, right? We just sort of sit here. What we got to do is bring them together.